Colleagues, partners, and friends. Infertility has gained unprecedented political and public attention in recent years. The release of WHO's global estimates of infertility prevalence, showing that 1 in 6 people will experience infertility during their lifetime, has renewed recognition that this is not a rare condition affecting a small subset of the population. It affects individuals and couples in every region, at every income level, and across every social group. At the same time, global anxieties over declining fertility rates have fueled new debates about demographic futures. These discussions, while important, are often conflated with infertility in ways that risk obscuring the underlying drivers, the distinct causal pathways, and the diverse experiences of those who are directly affected. But today, our focus is clear. We are here to address a critical and long-neglected piece of this complex puzzle, ensuring that fertility care, which includes services to prevent, diagnose, and treat infertility, is safe, effective, fair, and grounded in the principles of human rights and equity. Until now, countries, clinicians, patient groups, and partners have lacked a unified evidence-based reference from WHO to guide the provision of infertility care. This new guideline fills that gap. It brings together a rigorous body of evidence to support the prevention, diagnosis, and treatment of infertility, covering male, female, and unexplained infertility in a single comprehensive resource. It responds directly to requests from member states for clarity, consistency, and normative direction. The guideline builds on WHO's recent efforts to strengthen the availability of essential medicines and diagnostic tests for fertility care, including their inclusion in the model lists, a critical step in ensuring that people can access services without financial catastrophe. And it reinforces the broader mandate of WHO, that sexual and reproductive health, including fertility care, is an integral part of universal health coverage. The recommendations set out a coherent pathway for countries to adopt, adapt, and update their national clinical guidance. They highlight the need for implementation that reflects local context while adhering to global standards of quality, equity, and rights. Successful implementation will require collaboration, ministries of health, professional societies, civil society, and importantly, the people and communities most affected by infertility. This guideline makes a clear statement. Infertility services should be available at primary care level, embedded in financing and insurance packages, including in universal health coverage, and delivered without discrimination and without forcing people into catastrophic expenditure. For too long, infertility services have been among the most inequitable components of reproductive health care. Today, we begin to change that. Importantly, these recommendations are anchored in a comprehensive, rights-based approach to sexual and reproductive health. Fertility care must empower individuals to make informed decisions about whether and when to have children. It must be grounded in gender equality, bodily autonomy, and respect for the dignity of all people. This guideline is just the beginning. It acknowledges gaps in the evidence and highlights areas for further research. It signals WHO's commitment and the commitment of HRP to advance the science, build stronger health systems, and support countries as they work to ensure that fertility care becomes a core component of universal health coverage. I am confident that what we initiate today will transform how infertility is understood, addressed, and prioritized globally. Thank you for your commitment and partnership, and I wish you an engaging and thought-provoking webinar. And I hope you leave today not only informed, but inspired to go deeper, ask more questions, and join us in advancing this critical area of sexual and reproductive health.